Just last week, the Indianapolis City County Council declared racism a public health crisis. Racism is linked to higher symptoms of anxiety, depression, and trauma. Dr. Danielle Henderson is a clinical psychologist at IU Health. First off, Danielle, good morning to you.
Good morning.
All right, we're talking about short-term and long-term impacts racism can have on mental health. Why are minorities more likely to experience mental health issues like depression, anxiety, and trauma?
Sure. So one thing I want to make sure that I say is that mental health conditions do not discriminate by race or ethnicity. However, what we know is that minority communities often have disparities, socioeconomic disparities, and access to health resources, economic resources, educational resources, and it's often these barriers to care that can impact mental health outcomes.
Now, I know a lot of people, when you talk about trauma, they think about something necessarily just purely 100% physical. So why is racism considered a trauma experience for those basically on the receiving end?
Sure. Well, often experiences of racism can have a threat to one's life or perceived threat to one's life. And that's what we think about when we think about trauma. And then also now with the videos of people who have died due to acts of racism or been killed due to acts of racism, a lot of us have seen those and have been exposed to those. And so that could be a traumatic experience. And then in minority communities, particularly Black Americans, thinking about Native Americans, we have intergenerational trauma. So thinking about our family members who've witnessed traumatic events and have talked about those with us, that can impact us as well.
There's so much to see online, on television, read it in the newspaper, even in person. How can people cope with current events?
Sure. Well, I always try to tell people, try to focus on the day-to-day things. There's, like you said, there's so much. So trying to make sure that as best you can, you're drinking as much water as you need during the day. You're trying to do some sort of physical activity. You're taking breaks, focusing on your sleep, and also trying to make time for fun. During these stressful times, we can miss that. So watching something you enjoy, making a call with a friend that will make you laugh. And I also try to encourage people to seek mental health care sooner rather than later. If you have any concerns, it's never too soon to make that phone call or reach out for help.
All right, Dr. Danielle Henderson, clinical psychologist with IU Health. Danielle, thanks for being here this morning. We do appreciate it.
Thank you.